So it sort of drives me a little bit crazy when I get a massage and somebody just sectionizes me from one section, and when they finish, they're done, and I know that's it for the rest of the massage. You get to see a little bit of the grouchy art here. Moving down the body, you'll notice this throughout the whole series here. It's really important when you're working on one section to already talk to the next section you're going to. You get a feedback loop. If I'm working on the back and come down and do a little bit of work on the gluteals, maybe all the way into the hamstrings, that back is going to let loose. So one of the things to think about next is how do we move from this work we've been doing more on the upper thoracic down into the lumbars a little bit. How do we tie this in to the pelvis and yet have some very specific goals on what we want to have happen with the pelvis, and how do we work on that transition between the pelvis and the low back? So let's give you some specifics on what to do with that. On a broad level, your goal is to differentiate the pelvis from the spine. You want the pelvis to be able to rotate in one direction, the spine in another. Think of golfers, tennis players, yoga people, things like that. So you want to differentiate, but you also want to have a connection, a feel that when something happens down below, it's happening up above. So that's your broad goal. Remember that fascia all the way down the legs to the feet crosses all the way up to the head. So don't just think the specific muscles. Think globally, think fascially, and start working with these connections. Have the ribs able to move separately from the pelvis. That means when we move to the front, we're going to be talking to the abdominal muscles, but when we're in the prone position, we have to consider Quadratus Lumborum particularly. We also have to think that latissimus goes all the way up to the shoulder and attaches all the way down to the sacrum. So we're going to want to work on those broad areas, and then we're going to want to get specific with those small little rotators, so the muscles that are down by the sacrum, connecting the sacrum to the lower lumbars, the muscles connecting the pelvis to the lower lumbars. We want to be very precise there with those short little inch and a half long muscles to get them free. We have to consider also, is this person have an anterior tilted pelvis or a posterior tilted pelvis? How much lordosis do they have? Is their lower spine flat, or is it greatly rounded? That's going to affect the way we'll work, and we'll give you some rationale on how to work with that. Then we need to free the outer layers of the pelvis, the Gluteus Maximus. Free that from the deep rotators so that they can slide and work independently. Free that gluteus up, including medius and minimus, and then move into the rotators to relax them. Very, very important to be able to work with depth there. And then always, as we're working on this, we still have to continue. We have down the legs to all the way to the feet. So every once in a while when I'm working, I'm going to make a nice long integrative stroke, at least down to the knee, and sometimes walking all the way down to the feet to work on those. If you have these goals in mind, you can have a great rationale and fluidity to your massage that your clients will notice when they stand up. They're going to feel like they're working in one smooth movement. Okay, let's go into some specifics there. So let's continue our journey down the back of the body. We've covered up above, and I want to talk about a few of the specifics of the pelvis before we get into a continuous deep tissue massage connecting the upper body with the pelvis with the legs. So we have to consider this whole pelvis and what are the muscular, fascial, and bony restrictions that are preventing it from moving through all its ranges of motion. What's the tissue feel like? We want balance between left and right here, and I'm going to be giving you some specific particular techniques that then will blend into our massage in just a few moments here. So let's just take a look at some of the soft tissue things that have torsional and stabilizing force on the pelvis. So the first thing that comes to mind for me is the Quadratus Lumborum, comes along the crest of the ilium, attaches to the ribs, and a lot of our anatomy books focus on that, and they don't mention that the quadratus attaches to the lumbar vertebra at the transverse processes here. So I'm going to talk a little bit about that. We also have the iliolumbar ligament area, which is this ilium coming around like this, and we have the iliolumbar ligament stabilizing things here, and there's about 1.5 inches of muscle right in here that most people ignore and is just a gold mine to work on. So we want to make sure that we're freeing the pelvis from above. We also need to free the pelvis from below, and we'll be covering the legs later, but the main things that come to mind for me from below that attach the legs are, of course, the hamstrings. We've got the AB abductors, including tensor fasciolata here and the IT band, and then we have the adductors that are attaching to the ramus of the pelvis and stabilizing the legs for pulling in with adduction and providing support when the leg is in abduction. So let's talk a little bit about these muscles and how I would work with them individually, and then we'll put it all together. My mechanics are not going to be perfect here, so I keep my body out of the way. When I start doing the massage, hopefully it will be a little bit more fluid. So I want you to think about the gluteus maximus coming down in the direction of my fingers. Its major goal is to offer hip extension, connecting to the femur and lifting the leg back. Underneath are the rotators that are traveling in the direction of my fingers here, more often like this, up at an angle like that. And when they contract, they pull the leg into external rotation. So this would be external rotation of the leg, this would be internal rotation. So let's talk about the gluteus first. So a lot of people are a little bit afraid to work on this, and obviously you're not going to want to be pulling the drape down to get your hands on here, so develop your skill to work through the drape here. But the gluteus is a really important muscle. It gets stuck down on these rotators and is not able to slide. It affects how the rotators go. So the first thing we want to do is not work too deeply and take this gluteus, move it around over the rotators. Pull it down from its attachments, up above, nice and slow. When you feel specific areas that are tight, come back in with a little more precise work with your elbow. Follow along this sacral line here, all the way along the sacrum. Gluteus attaches, and freeing this gluteus is really helpful to get sacral movement so that the body can move the way it wants to. Underneath the gluteus are these rotators, and so this is where you need precision in depth. Sink through until you feel these rotators, and you'll feel little peaks and valleys as they're going this way and that. So what I like to do is first free the gluteus from those rotators, and then I need to grab these rotators moving this way and stretch them so that this leg can come down and move into internal rotation. They're external rotators. So I don't like to test people. I like to do that when I'm working, but let's just do a quick test with Kay to see what her rotators are like. So if I take her leg and hold it up at a nice 90-degree angle here, her knee is very, very stable. It's a nice way to use the knee, particularly if I stabilize with my hand here and test her internal rotation. Okay, we're getting to the end right here. She's got about a 45-degree angle, and that's absolutely fine. Depending on what her activity is, we may not want to increase that anymore, but I do want to show you what I feel is I feel some grabbing here. I feel these rotators like a rubber band fighting this. I want to show you how effective just a few minutes or even seconds of work can be. So we take her to the end, and I feel this end, and I'm going to come up on the other side, even though my mechanics aren't great. I definitely want to work on this leg at its end range. I'm not going to come back into neutral range. I'm going to bring it into where it ends, keep my body away a little bit, and sink right through the gluteus, grab these rotators, so I'm stretching them, and just wait for those to release. That's that melt that is so important. And you don't get it until you're at the end range. You need to challenge the restriction. So now I'm feeling those muscles soften. I'm feeling some of the lower muscles holding on a little bit more, so I shift, wait, and slowly she's letting go. I then get a little bit broader, follow this stroke down, try to be a little bit nicer to her because I've been working somewhat intensely, but that shouldn't feel painful at all. Let that stay there, and then let's just come back and test this mobility here. So we sort of relax her, shake it a little bit, and we let her leg fall. And she's got about another 10, 12 degrees. We come to the end. There's actually a little play. I could stretch it, but that's enough for here. So this is the important message that you have, is that you can do a ton of really important work in a short time. And you don't need to spend an extra 5 minutes working on this. When you feel the release, you're done. Let's go up above and talk about Quadratus Lumborum. So here's this big, broad strap of muscle coming along the crest of the ilium and attaching to the ribs in here. There's no trick to it. All we need to do, soft fingers. We don't want to use big, broad force. We've got our floating ribs down here, but we want to talk to Quadratus here. So I like to work with fingers, nice, softly bent, come in, sink through that outer layer, and scoop and stretch by pushing this pelvis down, letting those quadratus muscles release and relax, and let this pelvis start working in this direction and also work for side bending in this. So first we free, doesn't matter which you do, first or second, but first thing I'm doing here is I'm freeing this quadratus from its sort of anchor up here on the ribs. When I feel I've worked through enough there and I've felt that melt, I'm going to keep my body on the other side, but I would normally be working here. I might want to take her arm and move it up here to get these ribs pulling up, and then from this anchor here, I'd be lengthening quadratus up this way. Use precise force. We don't want to push those floating ribs down into the kidneys. And move her up this way. Start thinking about rotation as well. Let's get some freedom here for this body to move and rotate. Follow up. We want to connect the body, pull the pelvis down, get a nice stretch up here. Start thinking about some of that fascia. Start thinking about muscle we've already talked about, the latissimus dorsi, which goes all the way down to this lumbar fascia here. So we've got some really nice length in here now for quadratus. The other thing I want to mention is that so many people just worry about the belly, and it has all these attachments to the lumbar transverse processes of the lumbar here. So learn to come in, find out where those transverse processes are sticking out, come in and talk to those attachments nice and slow and easy right along those lumbar transverse processes. And you can feel there's just a great spot right there where some of these fibers are really tight and fibrous. So I come right in here. As I demonstrated on the sacrum, great work working with the fascia in here. Take your hands, fingers, knuckles, even a fist, but get this outside layer of fascia free. This absolutely feels wonderful as well. All the way down to the sacrum here, follow it down. If you don't want to work under the drape, you have to push a little harder, but come down here and feel this stress line that goes all the way down here. Okay. So we know that 3 of the hamstrings come up and attach to the ischial tuberosity right here. You should always be able to just immediately go to that ischial tuberosity. It's such an important landmark. If you're not comfortable with that, learn how to just follow the hamstrings up as far as they go, and all the roads lead to Rome. You're going to be right there on that ischial tuberosity. But you don't want to waste time having to find your way up there. A lot of times you should just be able to know right where it is, and then here are these hamstrings coming down. I like to, on this, just get right on the ischial tuberosity, so I'm freeing it from here. Pull that tendon down toward the feet. Wait for it to soften. That's going to soften the whole hamstring compartment here. And then the other thing that I like to do with hamstrings is think about whether it's pulling laterally or medially. Hers rolls this way, so I'm actually going to shift my body weight and actually start rolling this hamstring tendon here into a little bit of a medial position. I'm working on those Golgi tendon organs that are going to relax, and that hamstring is going to soften. Take your time. After you feel it soften, follow through, carry that down on the hamstrings. Notice how I'm pushing this whole arm like this with my body. And we're going to go down to the legs a little bit later. I wish you could see this if the camera were right up above. This whole posterior leg compartment has flattened out and relaxed where this feels bunched up. So we mentioned this on the fist. IT band, which we will cover later, attaches to the tensor fasciolata that comes all up along this crest of the ilium on the underside. And I love to work on the TFL here, above or below. Get that TFL lengthening to release pressure on the IT band, and think about rolling it. So I'm going to come in here, pull this down a little bit to just get on the lip of that TFL, get my body weight above, stand on my tiptoes, roll that TFL. So I'm taking this TFL and I'm rolling it around the pelvis, freeing it. Switch my direction a little bit, step back, keep those feet moving, and stretch it away, do some repeat strokes. If I want to get a little more precise, I can get a sharp elbow in here, right next to my thumb. Feel that coming down. Okay. And let's talk about another one. I see a lot of people taking the leg up into the frog kick position. It's a great way to tell what's going on, but a lot of people are just doing this without any real focus. They're just saying it's a nice move. So notice what happens in the body when you work this way. And it's a great way to also start tying in the IT band and the legs down the way. So I'm going to take her leg up, and you're going to let that pelvis go. Okay, so this is really something that a lot of people don't notice too much, is that as flexible as Kay is, there's something going on here that when I bring that leg up, her pelvis turns to a tilt here. Can you imagine if she's doing a lot of yoga or something, what that strain could be? One of the things could be that her adductors, which I'm going to work on later, are a factor, but I'm going to try to say, when I push this, what's resisting? What I feel is her pelvis wants to go this way. I'm going to stabilize her leg, lean into this pelvis, do some nice work on quadratus area, on the fascia, on the sacrum. There we go. Something started softening there. So now I've freed her pelvis a little bit from the spine, and I'm going to come over here because this is sort of pulled up this way. That's what's bringing that pelvis up. I'm going to take this whole abductor compartment, come over here, and roll this leg this way. So I'm pulling with my hand here, thinking of the bones, rotating the femur, taking the tissue, changing directions, coming on down. One stroke. Don't wear yourself out or wear your client out trying to make her perfect. Good way to then follow up, come down the IT band a little bit. Still think about this pelvis Always try to do work with two hands if you can. So my left is sitting here working along quadratus, feeling what's the rotational pattern that's getting her into this. Finish up and check out your work. So just that little bit of time, all of a sudden her pelvis is flat here. She's got a lot more movement, and you've done something in about 3 minutes here that if you're just sitting here and working this way, you're not going to accomplish.